This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. It's the beginning of a very busy news week. Tomorrow, Secretary of the State Denise Merrill joins us on Election Day. And of course, we want to hear from you too, especially if you're voting in person. That's tomorrow. Now, we know Connecticut is a solidly blue state when it comes to national elections. A majority of Connecticut voters have chosen Democrats in the last 7 presidential races. But we can't forget half of the towns in our state voted for Donald Trump in 2016. Liz Normand is a local voter who supports Trump.
I mean, Joe Biden is a nice guy, and Trump isn't. However, if you look at what's happened over the past 4 years, I'm really happy with my life.
Normand spoke to Ali Oshinskie, who reports on the Naugatuck Valley for Connecticut Public Radio. Ali joins me now on Zoom. Ali, welcome to the show.
Hi, Lucy. Thanks for having me.
You can join us too, 888-720-9677. That's 888-720-WNPR. You can also find us on Facebook and Twitter at Where We Live. Now, Ali, when we think about Connecticut residents who support President Trump, it's a perspective we don't often hear. You, again, did a recent story talking with Trump voters in Connecticut's Naugatuck Valley, so the western side of our state. Besides this being your beat, why did you want to highlight these particular voters in this community?
Yeah, well, like you said, Lucy, Connecticut is reliably blue. But if you look at the electoral map closely, like the 2016 presidential results, geographically it's purple. So 55% of Connecticut in total voted for Clinton, but 88 towns went for Trump. And that's over half of our 169 towns. And many of those towns are in the valley. And to clarify for those who don't know, because there's many valleys and many rivers in Connecticut, the valley is a region along the Naugatuck River. So it starts around Torrington, Litchfield area and goes all the way south through Waterbury and Naugatuck to Shelton, Derby, and Ansonia. And part of what brings me to Connecticut Public Radio is the Report for America program, which puts journalists in areas that local papers and local journalism has dried up over the last 10 to 15 years. So that's why I come to this region and to Connecticut Public. And on the topic of news, the folks I spoke to for this story, they cited a variety of sources that they get their news from. Definitely heard about Fox News in there, and also distrust of the quote unquote media. So this project was about, getting a reporter into the valley, making some connections, building some trust, as well as talking to Connecticut Trump voters.
I have to ask, Ali, when you mentioned that some of these voters don't trust the media, how did you get them to talk to you?
Well, it was a variety of sources, some Trump donor lists, some people I just started talking to. I think there's more trust person to person than maybe through email or other ways. So, just a lot of that sort of shoe leather reporting, as it's called.
And so tell me what they told you. Why are they supporting the president this time around again?
Yeah, so there was a lot of varied reasons. I heard a lot of people saying they liked his outsider status and they felt that career politicians hadn't worked for them in the past. And actually, after the story ran, someone emailed me and asked, I wished I'd heard about policy issues. I wish these voters had talked about it. And I thought, wow, that was suspiciously absent from a lot of the conversations I had, even after pushing some of these voters to say what policies they liked. And so I think one takeaway from that is that part of the reason people like Trump can be based in feelings or political sentiments or identity rather than specific policy conversations. Although there were some people who shared specifically policy ideas.
That's interesting. We know that the President Trump is one of the most divisive political figures in recent history. One of the reasons is the way he talks about race. To remind our listeners, he has called Mexicans, quote, rapists. He has refused to denounce white nationalists. And we've seen in this campaign cycle, Ali, he continues to lean into these fears from suburbanites, white suburbanites, about low-income housing coming into the suburbs. So when you talk to these particular Trump voters in the Naugatuck Valley, how did they view the president's rhetoric around race and racism?
Yeah, well, it's definitely on their minds. A common theme I heard was anxiety around changing demographics. But I'd hope we could hear from some voters. So I brought in some tape. This is Liz Normand, who you heard at the top of the show. She's a nurse in Prospect, and she lectures on nursing. For those who don't know, Prospect is a suburb of Waterbury. So Prospect is 94% white. Nearby Waterbury is 36% Hispanic or Latino and 17% Black. And that's data from the Connecticut Data Collaborative. And she started this comment by saying, I don't think we're racist. I think we're ignorant, because in small towns like Prospect, we don't see how cities struggle. I'll let her take it from there.
Waterbury is, 5 minutes away, and that's a hard town for me to go to now because there's so many diverse things going on, good and bad. I'm just I don't feel like I'm part of that community anymore because I kind of believe that every Black person is a Democrat because they think Trump is a racist. And that's not true. I don't think he's a racist.
And I should also add that Liz did say she believes in the basic idea that Black Lives Matter and was interested to learn more about it. But race and racism in America today came up in every conversation I had, with or without my prompting. And I think this is something a lot of Trump voters want to talk about. But I heard a lot of discomfort with the idea and offense at the idea that America is a racist country, or that supporting the president is seen as inherently racist. And Trump's rhetoric, I think, has really penetrated, especially the rhetoric about racial justice riots or protests this summer. I heard some misinformation about that, too, like the idea that there were more violent than peaceful protests this summer, which we should add is not true. A majority of the protests were peaceful. But I think there's a lot to take away from this. But one easy conclusion I think we can make is that the definition of what racism is really differs from person to person. And so conversations on race sound very different across the state of Connecticut.
You're hearing Ali Oshinskie here on Where We Live. She's a reporter for Connecticut Public Radio. She covers the Naugatuck Valley. And we're talking about a recent story Ali did about Connecticut residents who supported Trump in 2016 and who plan to do so again tomorrow. So when you talked to these Trump voters about race, but you also brought up COVID, of course. And how did they view the president's handling of the pandemic, Ali?
Yeah, also there was a lot of variation on this one too. On this answer, there were more tentative responses. And I should add that like all the folks I talked to had some variation of, I wear a mask, I've gotten tested, shared some conventional wisdom about the virus. I also heard a lot of love for Governor Ned Lamont's response to the virus. So I think the local and the national, there's a difference there, but they're seeing it work in their neighborhood. So you'll hear again from a voter. This is David Nastry. He's a financial advisor in Waterbury, and he shifted some of the doubt to the media. So I'll let him explain.
When we have conflicting medical advice, we have conflicting medical advice. It means we don't have an answer yet. So if I lean on one side or the other, I'm not necessarily lying. I might be wrong. I might believe it hard, but I still might be wrong. It's not the same as saying that I'm lying. And so I have gotten to the point where when I hear that in the media, I take any criticism of the president with a grain of salt.
So there you hear him sort of, making some sort of rationale for the president. But also I should add, almost everyone I spoke to did have some criticism of the president's behavior, demeanor, or language. But they obviously do like some or a lot of things about Trump. So not to hear anything positive about him in the media actually breaks their trust with the media because they like this guy. And I think a lot of this translates into wanting to defend the president. So back on the topic of COVID, I heard a lot of praise for Trump's decision to close down travel from China early on. A lot of praise for that, but not so much talk of recent events. And I also heard how Trump's rhetoric blaming China for the spread of the coronavirus really stuck with a lot of supporters. But COVID is like a really hard issue for all of us, right? And at least for the voters I spoke to, it was too. It's impacted all of our lives, some of them in really traumatic and terrible ways. And like you heard Liz say at the top, what she called voting with your heart might mean a vote for Biden. And she said that she expects some people to do that. But at least for the folks I spoke to for this story, they were all solidly in support of Trump, and they're all hoping for another 4 years.
I'm curious, Ali, after your story aired, what was the response from listeners to what they heard?
I didn't get a lot of emails in response, but I think as I was reporting this story, I was really struck by what different media consumption worlds I was living in compared to the folks I was speaking with, and what is seen as true and what is seen as more flexibly true. And the whole process for me has really been eye-opening. But I'm hoping to hear more from people. And if anyone has thoughts on it and wants to share, feel free to send me an email.
Now, we know Election Day is tomorrow. Ali, will you be back in the Naugatuck Valley, and where?
Oh, yeah. I will be all throughout the Valley tomorrow. I'll be in Torrington and Waterbury, checking in on the polls there, talking more about how the vote is happening with absentee and lines at the polls and all that. And then we will be you and John will be doing a broadcast, and you'll see me a bit on that.
Nice. That's right. So I will be hosting a show with John Henry Smith of Connecticut Public Radio, our local ATC host, as we talk with Ali and some other Connecticut Public Radio reporters, as well as Hearst, Connecticut reporters. That's being that program will start tomorrow night at 6 on CPTV. You can hear it on Connecticut Public Radio, and of course streaming at ctpublic.org. Ali, thank you so much for coming on the show today.
Thanks for having me, Lucy. It was fun.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, no excuse absentee ballots in a pandemic have led to a lot of discussions about how to change the ways we vote. In Massachusetts, voters will decide whether their state should allow ranked choice voting. We'll hear more about that after the break. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. No matter the outcome of this presidential election, many of us want to see changes to how we vote each election. Connecticut doesn't have early voting like other states. Also, could no excuse absentee ballots be expanded here beyond the pandemic? Those are some of the questions being asked. How about ranked choice voting? Ranked choice voting is something that's been talked about in our state. Our neighbor, Massachusetts, has a ballot question before residents tomorrow that could change the way they vote. Are you watching to see if ranked choice voting happens in Massachusetts? Do you want this type of voting in our state? We want to hear from you. 888-720-9677, or find us on Facebook and Twitter at Where We Live. Joining me now on Zoom is Matt Stout. He's politics reporter for the Boston Globe. Matt, welcome to the show.
Thank you for having me.
We know ranked choice voting is also referred to as instant runoff. So tell us how it works.
Yeah, ranked choice voting, at least on the front end, works very much as it sounds. If you have, say, 3, 4, or more candidates on the ballot, voters get the opportunity to, instead of just picking one, ranking their preferences, assigning candidate A their first vote, candidate C their second vote, and candidate B their third vote. And then from there, it's slightly more complex. When essentially election officials are tabulating the votes, if no one reaches 50%, because the system is sort of designed to ensure that you have someone with a majority who wins, the candidate that receives the fewest amount of votes in that first round is essentially eliminated, and then their voters are redistributed to the remaining candidates based upon their second choice. And then it's again retabulated to determine whether someone has 50%. And sort of that process, depending on how many candidates there are, continues until someone has 50% plus one, if you will, to be the winner. And that's generally how it works. Although, there could be different forms of ranked choice voting, but that's essentially what is on the ballot here in Massachusetts.
I understand cities around our country have had ranked choice voting for some time, including, I believe, Cambridge. So I'm just curious, why is this before Massachusetts voters in a ballot question? Were there recent races that advocates point to about why this is needed?
Yeah, in Massachusetts, at least the best examples, for lack of a better term, that advocates point to is we've had a series of Democratic primaries for Congress in recent years in which you have, 5, 9, 10 candidates running. And wow. Every single time, the winner of that primary is getting 23% of the vote. There was a special race in 2013 where the winner, now Representative Catherine Clark, got a little over 30% of the vote. And that has helped sort of fuel the calls for changing our system, because especially in Massachusetts, where Democrats hold every single seat in Congress and in our U.S. Senate delegation, essentially those Democratic primaries are the ones that are ultimately deciding who is in Congress. So there's frustration where, we here in Massachusetts, south of Boston, we had a congressional race just this past fall where there was 9 candidates on the ballot. And the winner won with just about 23%. And, to advocates are pushing for ranked choice, the feeling is that our current system, you may not get a candidate that reflects what the majority of voters want when you're having a winner literally with the sliver of the electorate essentially winning office.
When we think about our current system, Matt, there's also the idea of spoilers, and that exists today. But with ranked choice voting, that idea could be eliminated?
That's the argument, where if you have, say, 4 candidates in a race, you have a Democrat, a Republican, and 2 independents, whether they're leaning more conservative or more liberal. The argument for ranked choice vote is if you as a voter like one of those third-party candidates better, you're allowed to rank them first. And if they have a low chance of winning, you could still rank, say, the Republican or the Democrat second. And if your first choice is eliminated because no one gets 50%, then your vote is reallocated to your second choice. And it's sort of this idea that you're not throwing your vote away, or at least, you could sort of vote with your heart and still have an impact on the final outcome of the race. I mean, that is one of the main arguments for it. That's the argument here in Massachusetts, and that was one of the main arguments when it was adopted in Maine, at least for the first time in 2016.
You're hearing Matt Stout here on Where We Live. He's politics reporter for the Boston Globe as we learn more about the ballot question before Massachusetts voters tomorrow, whether to support ranked choice voting. If you have a question, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. So Matt, tell me more about what polls have shown in terms of Massachusetts voters. Is this something that they're supporting, and who's opposed?
Yeah, there's hasn't been a ton of polling. There was one poll in August, which essentially showed the electorate split, with a lot of people undecided. There was 2 recent polls that showed at least support for ranked choice voting, slightly ahead of those who said they were going to vote against it. But it's largely close or very close to the margin of error. So it sort of feels like there is it's not really sure how it's going to go tomorrow. And in terms of opponents here, the Massachusetts Republican Party has come out against it. The governor, Charlie Baker, who is a moderate Republican, has also said that he is not going to vote for it. And there is a formal committee that has been formed to oppose the ballot question, essentially starting by some Republicans up here in Westford, Mass., although they have not raised the amount of money or have the visibility of the committee that's pushing the ballot question. So it's largely formed to a certain degree along ideological lines, where you have Republicans and more conservative people on the spectrum against it. And then for it, Democrats, there are some prominent Republicans who are supporting it, such as former Governor Bill Weld here. The Massachusetts Libertarian Party, Democratic Party, and the Green Rainbow Party have all endorsed it. So there is support for it, kind of goes across the political spectrum, but essentially opposition is rooted in more the Republican end of it.
You mentioned Governor Baker. I believe he won with 48% of the vote.
That is correct. In one of the closest elections we've had in decades, back in 2014.
And so if ranked choice voting existed in Massachusetts, that would be an example of a race where, it could change depending on how your voters are ranking their candidates.
Yeah, that race, as well as the first race he ran in 2010, where he lost to Governor Deval Patrick, and you had essentially the state treasurer there, Tim Cahill, who got a pretty substantial, I want to say 8 or 9% of the vote. So that was also a race where ranked choice voting could come into play. So there is the gubernatorial races that sort of fall into that category for sure.
Now, you mentioned Maine, so let's talk about how ranked choice voting has been going in Maine. You wrote a long story looking at the promises advocates in Maine said ranked choice voting would bring. So how has it worked in Maine? Have they seen things like partisanship decreasing, or the fact that how money goes into campaigns changing?
It depends on the race. One of the first races, or essentially the first major race that ranked choice voting was applied to, was their gubernatorial primary, Democratic primary in 2018. And within that race, you had two Democrats that essentially ran together. They appeared in a campaign ad, urged their supporters to rank one of them first and the other one second. So you have this novel level of civility, which advocates for ranked choice voting says it encourages. And then you look at some of the other high-profile races, and it sort of feels like ranked choice voting hasn't really affected what we've seen out of campaigns. They had a congressional race in 2018 in the 2nd district there, as well as a U.S. Senate race this year, and you're seeing, almost records amounts of money flowing in from outside the state for advertising. A lot of it negative, very sort of sometimes nasty rhetoric between the candidates. And so even though ranked choice voting says, it could promote civility, it encourages, or at least incentivizes candidates to appeal to a broader base of supporters. You have a congressional race which helped decide sort of which party controlled the House in 2018. You have a Senate race that is part of the same discussion of who will control the Senate after this election. So those forces of people from outside the state and just, a lot of money flowing into it to help influence the decision sort of overwhelm, if you will, the potential benefits that ranked choice voting have. So it's been a mixed bag. And frankly, this is, even though it was first adopted in 2016, this is only the second election cycle that it's been used. So, talking to political science in Maine, they say it's sort of too early to judge whether this has been, the full out success that people say it could be, or if it hasn't lived up to it. It's sort of an experiment still in process, if you will. Mm.
Now, we know Maine is very different from Massachusetts. In Maine, ranked choice voting is being used in the presidential election, but that's not something that would be the case in Mass if the ballot question passes.
Correct. Maine is the first state to use ranked choice voting this year in their presidential election. In Massachusetts, it'd be used for our statewide offices, governor, attorney general, our legislative races, our congressional races, both for primary and as well as general elections. But municipal elections and presidential elections are excluded from that. So, there's a pretty clear distinction in the proposal here of what it would actually be used for.
When we started talking, you mentioned that people often can be confused about ranked choice voting, but as there's been more awareness to this ballot question, do you think that a lot of voters understand it and are embracing this kind of change, Matt?
It's hard to say if there's a full embrace, largely because the polling has been so split. I think that the general concept of ranking your choices is pretty easy for people to grasp. I think there is sort of this confusion, or at least questions of, well, once I put my vote in, what happens next? There is that added layer of complexity that comes with tabulating and counting votes for a ranked choice election. So I think for some people, even I've talked to people in Maine who are, 2 election cycles into it, and there's still sort of this question of, well, what happens if I don't rank everyone? Do I have to rank someone beyond my first choice? So there's still a feeling of trying to feel it out. And even in Cambridge, where they've used a form of ranked choice voting for 80 years, there's still some people that are trying to grasp of, well, what happens next after I spit my vote in? So that, to a certain degree, still exists and will exist. And yeah, it's going to take a lot of voter education should this pass to let people know sort of the process. But I think just naturally, we're so attuned to, you cast a vote, they count them up, whoever has the most wins. It is very simple and something we understand because we've been doing it for centuries. It does take a little more of sort of wrapping your head around, or at least just learning about how a ranked choice voting election works, because the process of here are three choices, put 1, 2, or 3, or 1 and 2, whatever you prefer. People get that. I mean, we do that with a lot of things in our lives. It's sort of the back end of it, of what's happening when they're actually deciding, or at least figuring out who won, that I think people are a lot of people are trying to grasp or learn about.
Now, I've been talking with you about ballot question number 2 before Massachusetts voters, again, whether they support ranked choice voting. But before we end, I have to ask you about the ballot question number 1, because we've done here on Where We Live a whole show about right to repair, and that's before voters tomorrow. Can you briefly tell us about that?
Yeah, so the right to repair ballot question here is essentially a return, if you will, to what Massachusetts voters decided on now 8 years ago. At that time, for our first right to repair question, essentially Massachusetts voters allowed for the first time, and it sort of set a precedent across the country, of allowing independent shops the ability to plug into cars, if you will, and be able to access diagnostic codes and other information they would need for repairs. Essentially, it was pitched as, well, you're giving people more options because they're not limited to only going to a dealership that would have access to this type of mechanical data. With this one, it's more complicated because it would allow access to what is called telematics, which is the wireless data that's currently transmitted from a lot of our cars, especially the newer models, back to the manufacturers, to which their dealerships and where they repair cars also have access. So it's opened up this whole discussion, debate about cybersecurity and security of our data, of what are our cars spitting out every single day, and who could see it. And with this ballot question, it would call for the creation of essentially an app that would allow the owner of the car to access that data and to give, say, an independent shop the access to it as well. But there's questions of, well, what would this app look like? The ballot proposal itself isn't specific in some ways, sort of leaving that to be decided within the industry. But it's created this, what is now the most expensive ballot question we've had in Massachusetts, where you essentially have automakers that are pouring millions of dollars into defeating the question, and sort of aftermarket parts dealers, the auto zones of the world, that are pouring, equal amounts of money into, passing it. So yeah, it's become as much of a question of, well, where you should have a right to choose where you want to have your car fixed, into this very complicated, how secure is your data, and essentially what is a automobile industry war playing out on the ballot here.
Mm-hmm. Well, we'll be definitely watching that one, Matt. Matt Stout, again, is politics reporter for the Boston Globe, talking about a couple of ballot questions before Massachusetts voters, both issues, something that people here in Connecticut are also interested in. Matt, thank you for your time. We really appreciate it.
Thank you very much. Anytime.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we're going to shift away from talking about elections and ballot questions to focus on your health, specifically to ask you, have you gotten your flu shot yet? We'll hear from an infectious disease expert about why it's important now more than ever. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Election Day is almost here. On the next Where We Live, Connecticut Secretary of the State Denise Merrill joins us to talk about how voting is going across our state. Will you vote in person, or is this your first time voting? We want to hear from you. That conversation tomorrow. Now, have you gotten your flu shot? Health professionals have recommended Americans get a flu shot to avoid a potential twin-demic. As COVID-19 cases and hospitalizations rise in Connecticut, Governor Ned Lamont had this sobering news last week.
I look at it as the second wave.
Joining us now on Zoom is Dr. Jessica Abrantes Figueredo, Chief of Infectious Disease at St. Francis Hospital in Hartford. Dr. Abrantes, welcome back to the show.
Thank you so much for having me.
Now, we have COVID-19 cases rising, hospitalizations increasing in our state. We just heard Governor Lamont telling residents late last week that we are seeing the start of the second wave of this pandemic. This is also the time of year when we hear that we should be getting our flu shot. You're a doctor. What are you hearing from your patients? Are people taking this seriously?
So I think people are actually taking this serious. We're seeing a lot of our patients requesting flu shots. We're obviously recommending the flu shots this year. I recommend the flu shots every year, but this of all years is so important to make sure that we can cut back on any respiratory virus, especially since we are clearly in the midst of our pandemic and clearly seeing the next surge.
When we think about a surge, we know that in the pandemic, when we had a peak in the late spring in Connecticut, the overcapacity of hospital systems is a concern. And so is that something that you're worried about too, that with seasonal flu, if it spikes, you're going to see shortages of beds and also equipment for people who are sick with these respiratory illnesses?
Absolutely. That's definitely a concern that all physicians and all of our hospital administration has. And we are closely looking at all of those things and the numbers. And as much as we want to, yes, protect our healthcare workers, decrease hospital capacity so that we're not overwhelmed, this is really for the community to prevent infection, prevent severe illness where they then require hospitalization or even an ICU stay.
You can join our conversation as we talk about getting your flu shot in a pandemic. The number 888-720-9677 if you have a question about the flu vaccine or just in general about whether it's safe to head to your doctor's office in this pandemic. Is that something that you're seeing from your patients, Dr. Abrantes? Are people more willing to go and get regular checkups in a pandemic?
So I think it's definitely that people have been fearful. I think we are seeing less of that fear now, only because we know so much more, although we're still learning about COVID-19. Our hospitals are well equipped, clinic staff as well, and we're taking all of the safety measures too for both patients and providers. So providers are wearing masks, even eyewear protection, and then we have all patients as well wearing masks too so that each is protecting each other.
When we think about the flu shot in years past, oftentimes people wonder how effective the vaccine is. And so I'm wondering, what are we hearing about this particular vaccine for these strains this upcoming season, Dr. Abrantes?
Sure. So typically it's difficult to project the effectiveness. We try to look at those who are making the vaccines at prior years, and sometimes it's difficult to predict. But what we do know is that even in years where we have very low effectiveness, it actually still helps and works to prevent, people from needing to go to the doctor, people from having to be hospitalized for flu, or even deaths as well, too. So even if it's a low effective vaccine, it can still do so much good if we have a sufficient amount of the population getting vaccinated, and that's key.
When we think about effectiveness, too, we often look to flu seasons in other parts of the world, including the Southern Hemisphere. What are we hearing in terms of the flu season?
So the Southern Hemisphere is actually seeing a very, low or tame flu season, and yet with many of them still doing a lot of testing. So it goes to show that likely what we're doing for COVID-19 is helping to prevent the influenza season being a harsh one. That being said, we can't necessarily just guess or estimate that we are going to see the exact same thing that the Southern Hemisphere has experienced. We're seeing our cases in COVID rise, and that's mainly because it's much more contagious and when we're comparing it to influenza. So, again, hopefully we can see that type of similar season, but again, it depends on us as healthcare workers, our community, to being vaccinated, to continue all these strategies for COVID-19, like wearing masks, keeping our distance, and washing our hands.
Anecdotally, I have 2 children in a hybrid school schedule. So they're in school just a couple times a week, but they have to wear a mask. There's constant hand washing and hand sanitizing. And I have to say, Dr. Abrantes, for November 2nd, neither of my children has had a cold yet. That must be a good thing when we think about some of the preventative measures for in this pandemic, having the masks on, keeping distance from others.
Absolutely. I'll say it the same thing too. Both of my kids are actually ended up being in full in-person. I have someone in daycare, my daughter, and my son in-person school as a first grader. And that just goes to show, our strategies are working. My children also haven't had colds, coughs, and in school too, they've been doing such a wonderful job in encouraging hand washing, keeping their masks on too, and trying to do other things with the children, like going outside when they can, so that we can prevent the spread within school systems.
You're hearing Dr. Jessica Abrantes Figueredo, Chief of Infectious Disease at St. Francis Hospital in Hartford, as we talk about the twindemics that health officials are worried about, the fact that we're in a pandemic for COVID-19, and it's also the start of flu season. If you have a question, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Richard's calling in from Woodbury. Richard, what's your question?
I'm 75 years old, and when I went in to get my flu shot, I didn't realize at the time that there was an extra strength flu shot they recommended for seniors. My doctor didn't tell me. I didn't know to ask. I got the regular flu shot, and some weeks later, come to find out there is that stronger flu shot. And so I'm wondering at this point, do I just have to buy with the regular shot, or after a certain time can I go back in for, that extra strength flu shot when it's available, or a second regular flu shot?
A good question, Richard. What can you tell him, Dr. Abrantes?
Sure. I was going to say that is a great question. So there are recommendations that for folks who are over the age of 65, they can actually consider getting the higher dose flu shot. That being said, it's, not an absolute that you have to get the higher dose. I would say that you've done a great job in going to get the flu shot. And unfortunately, sometimes maybe clinics or certain areas may not have access to the higher dose. And really for me, for most ID physicians, they would say any flu shot is better than no flu shot. Since you've already gotten the flu shot, I wouldn't necessarily recommend that you go and get the higher dose. But again, it is one of the recommendations that we can do. But that being said, folks who are over 65 can also still get the kind of quote unquote regular flu shot as well.
I'm glad Richard called in because I saw reports from Hearst, Connecticut. Dr. Abrantes, Mick Boldick, an epidemiologist and vaccine coordinator for the State Department of Public Health, talking about this high-dose vaccine for Americans over the age of 65. It's not easy to get. People are having a hard time finding it. And so I'm just wondering, again, just to reiterate, if they can't get the high-dose vaccine, if they're over 65, you're saying that the regular flu shot should be taken in that situation.
Absolutely. So again, it's a recommendation, but just like you mentioned, there may be times where it's difficult to get it. So instead of waiting, especially now that we're already in November, typically we say October is a great time to get the flu shot. And now that we're in November, definitely a good time to get the flu shot and not necessarily wait. So getting the regular flu shot is also a good idea.
Again, you can join us if you have a question about the flu shot at 888-720-9677 or find us on Facebook and Twitter at Where We Live. We know that in the pandemic, COVID-19, the elderly are most at risk. But when we think about the flu, who's most at risk of getting this respiratory illness, Dr. Abrantes, and having complications from it?
So it's similar, and there are similar crossovers too. So usually with the flu, however, we see the very young, although I'm not a pediatric infectious disease doctor, but the very young and also the much older population too. So kind of those two extremes. We don't see that necessarily with COVID-19. with the younger children, although certainly children can also get infected. And similar things too with regards to people who may have underlying lung disorders, so COPD or breathing issues, as well as cardiac conditions too. So both kind of, they're similar, obviously, but also different, but both with similar risk factors.
Deborah from Watertown wants to know about the pneumonia shot. She said it just became eligible. Does this provide any additional protections from COVID-19, Dr. Brontes?
Good question. So it does not provide additional effectiveness or, for COVID-19. However, sometimes we do see folks who have COVID-19 go on to develop, bacterial infections. And regardless, even if this was pre-pandemic, I would definitely say as well, if you do qualify for the pneumonia vaccine, to getting vaccinated, as that too is important to prevent bacterial pneumonias.
Are you worried about communities of color? We know that COVID-19 has disproportionately impacted them. When we think about people of color in our country, historically they have chronic health conditions. Does that put them at a higher risk if they get the flu, Dr. Brontes?
Absolutely, something very similar. And yes, they've unfortunately been disproportionately affected by the virus. It's something that we talk about as well as, now that we're mentioning the flu vaccine, and even as we start to consider the COVID vaccine as well, to making sure that they have the access to those things, flu clinics, for example, to get vaccinated, so that we can, again, help to prevent infection, hospitalizations in that community that has been much more greatly affected.
When we think about getting the flu shot, we're thinking about our individual health and the health of our family members. But there's also this idea that when you get the flu shot, you're helping protect your community.
Absolutely. I think the biggest message I could give for, what we're going through with the pandemic, COVID-19, it's not just about personal, but, what you do to help protect yourself is actually helping the community as well, and the spread. The same thing with the vaccines. There are some people that may not be able to get the flu vaccine, so they depend on other folks around them to be vaccinated.
We talked about efficacy a little bit earlier. Can we talk about some misconceptions about the flu shot, Dr. Brontes? You laid out that it's important to get the flu shot because even if you were to get a particular strain of flu, it may not be as serious as if no flu shot at all. But there is still a belief out there that the flu shot causes the flu. What can you tell our listeners?
Sure. So in short, really, the flu shot does not cause the flu. There are different strains. And the other thing, too, that we typically see is there's so many circulating respiratory viruses. So that's what people can sometimes see as well after they get the flu vaccine. And it's just a coincidence and timing. The other thing is that a lot of times people may have not a true reaction, but kind of feeling a little down, under the weather, that arm ache that people can feel as well, a little feverish. And that's really not them getting sick. That's actually their body reacting to the flu vaccine and their immune system boosting so that they can protect themselves against the flu. And you are right that even though folks can certainly, unfortunately, get the flu, even with the flu vaccine, typically what we see is a much more milder disease, folks not having to be hospitalized, and, which is much better than having to be hospitalized, consideration for ICU stays, et cetera. So very important that people know that the flu shot does not cause the flu.
There have been some headlines recently, Dr. Brontes, citing preliminary research on the possibility that getting the flu shot might reduce a person's likelihood of contracting COVID. Again, this research is in the very early stages. What's your reaction to that?
So definitely, I've heard of those things and very in the early stages. Unfortunately, given that they're two separate viruses, it's something that I don't think we can, absolutely say, oh, well, you're going to get the flu shot and you can have some prevention in COVID-19. Only because a lot of times these things that we end up saying, it may put a false sense of security into folks, but definitely nothing that's been confirmed. And again, not something that I would then tell people that they don't have to worry about COVID-19. So again, back to the basics of hand washing, wearing a mask, and keeping our distance to help prevent the spread.
Mary's calling into where we live. Mary, what's your question?
Yeah, my question is, a friend of mine got the high-dose senior shot a month ago. She ended up 8 hours later with a lot of dizziness And then eventually when she went to sleep, she woke up and she was numb from her waist down. I went to get the shot. My doctor's office, I've got it the last 4 years, no problem. And I asked him about it. And he said, well, it's a very rare syndrome. I'd like to know the name of that syndrome. But he said, I've had 2 people who come to my office here who got the shot who had the same reaction. So I'm a little concerned about getting it, to be quite honest with you. And I'm thinking, should I just get the regular low-dose one? Or what have they heard about this?
Sure. So there are, and I'm just assuming because I don't know the full story, but there are reactions that people can get to any vaccine, just like we can get any reactions to medications. What it sounds like what they're referring to is something we call Guillain-Barré syndrome. And what's interesting is that both the flu vaccine can cause it, although it's extremely rare, and actually also influenza. So having the flu, the infection can actually cause this as well. So in my career, I've definitely actually seen both happen, although very, very, very few numbers. But it's a risk benefit that, if you've done fine, and this is why folks always get questioned before they get the flu shot, that if they've had any bad reaction, including Guillain-Barré syndrome, because then that has to be a discussion between you and your physician. So unfortunately, when you know somebody that's had Guillain-Barré syndrome, it makes things that much more scary. But again, the numbers are extremely, extremely rare. And it would still be safe and, needed to get the flu vaccine so that we can prevent influenza, the hospitalizations, the deaths that we do see from flu.
And for Mary's question, Dr. Brontes, if she's still a little hesitant to get that high dose flu shot for people over 65, you would recommend she get the regular one just to be safe.
Absolutely, yeah. These always come down to conversations between patient and physician. And if you were to feel uncomfortable and you've done just fine with the regular dose, then I would say absolutely go ahead and get yourself the regular dose flu vaccine.
Chris called in from Wethersfield and wanted to know, is there a price difference between these 2 flu shot strengths, Dr. Brontes?
That's a good question, and I'm not sure I know the answer. Typically, though, the flu shot is covered by most insurances, and I know a lot of pharmacies and big retailers also try to promote getting the flu shot for very minimum for folks who don't have insurance. So I'm not sure that I can answer that question completely.
Just to end, Dr. Brontes, we heard Governor Lamont talking about the start of the second wave for COVID-19. As an infectious disease doctor at St. Francis, what are your concerns moving into the next couple of months?
I think the biggest concern is to see what we saw before with large our hospital being really at capacity and it really overwhelming the healthcare system. And not only that, all of the unfortunate illnesses that we saw, the impact that it has on patients and obviously families as well. So I can't stress enough that this is not just about healthcare workers or one community. This needs to be all communities really coming together. A lot of people are coming up with slogans, ones that I've heard about the 3 W's. So wear your mask, watch your distance, wash your hands. These are things that are so important. And especially as we go into the holidays, Thanksgiving is coming up, Christmas, Hanukkah. And really what we've been seeing driving some of the infections is actually just small family gatherings, people opening up their homes to, extended family and friends. And just remembering all of these things, because so many infections can be asymptomatic and then unfortunately leading to spread among people that are much more vulnerable. So it's such an important thing as we go into this next surge.
Well, Dr. Jessica Brontes Figueredo, Chief of Infectious Disease at St. Francis Hospital in Hartford, part of Trinity Health of New England. Thanks for your time today.
Thank you so much for having me.
I'm Lucy Nalpathanchel. Today's show produced by Carmen Baskoff. Thanks for listening. And don't forget, tomorrow we want to hear about your voting experience.